How do we make the tools that we have, which are very powerful and do work, but they can only be used if the person using them feels that they're of value and makes their life easier.
That was the voice of Neal Patel, CIO of Health IT for Vanderbilt University Medical Center, explaining how he works to bridge the gap between the clinical and IT worlds. You're listening to How I Transform This, presented by Versus 12. Versus 12 is the award-winning Salesforce Gold consulting partner focused on healthcare innovation nationwide. In this episode, Neal discusses some of the challenges and advantages that come with integrating new technology into the clinical process. He describes how the rest of the Vanderbilt IT team focus on improving the ease and quality of care from both clinical and patient perspectives.
For Vanderbilt, our continued push is to continue to impact how care is delivered, how we utilize all of our tools, not just technology tools, to advance the way healthcare is delivered not only in the city or this region, but nationally.
I'm your host, Clark Buckner, and along with Versus 12 founder and CEO Tammy Hawes, each episode we're seeking out healthcare technology industry leaders, exploring stories of success through the transformation of healthcare. For more stories like this, head on over to versus12.com/podcast. Now let's jump in.
Hello, my name is Neal Patel. I'm the CIO of Health IT at Vanderbilt University Medical Center.
Welcome. I am so thrilled to have you in the studio today.
Yes, and I'm very excited too because I know a little bit of Neal's story, and I know that in past episodes, people that I have had on, I think I know their story until they start telling it, and there's all these great nuggets of information.
Same here.
So I'm excited to hear about it.
So we here on How I Transform This, we love to hear from the guests just a little snapshot of their background, their past, and that helps us understand how it really has shaped their present. And we're really excited to hear about the work you're doing at Vanderbilt University Medical Center, hearing about the innovations that are happening, and just hearing your thumbprint, like hearing your story and how you've experienced transformation and innovation. So before we really get to talking about today and eventually talking about the future, how about we just rewind it back on how you got your start in healthcare? Can you take us back to that?
Sure. I'm a pediatric critical care physician by training. I did my medical school in Los Angeles and my training in pediatrics and pediatric critical care at Children's Hospital of Los Angeles. This was back in the early 90s, where computers and healthcare weren't really a thing. And our hospital was actually early in trying to have the clinicians adopt computerized physician order entry. The difficulty at that time was most clinicians or most people weren't used to having computers in their life. And so it was viewed with a lot of apprehension and worry that efficiency will be impacted. But more so, when it was really rolled out, it really did not work. Our residents threatened to go out on strike if they had to use the system.
Whoa.
It was pretty noteworthy. So as I continued on my training, we would continue to do documentation on paper. And in my senior year, or my third year of residency, our IT leadership changed. They appointed a clinician to be the medical director of IT, and he happened to be the attending on the clinical service that I was on. And so he asked me one night on call and said, "Patel, what would it take for you to enter what you're writing on the piece of paper into this computer?" And so I peered over our medical receptionist's shoulder and looked at what they were entering and kind of commented that I could do that, but it looked wholly inefficient. And the most important question that he asked was, why? And I said, well, because I've written these orders in a particular sequence, and the receptionist is having to navigate all over the place trying to enter them because the screens were not in the order that I had written my orders for a patient that we're admitting. And just that conversation alone that night initiated my journey into being a clinician who could translate the clinical world to the IT world. And very soon after, I was involved in helping change the design, the look and feel of the system to help clinicians do their own order entry. And we got to 95% usage without forcing anybody to do it, just by better design and thinking about how clinicians think, which is often not logical, but it's important to know what a end user's expected workflow is. And if you match it, then you're most likely to get much better adoption. And to this day, that's really the role that I tend to play, is how do we make the tools that we have, which are very powerful and do work, but they can only be used if the person using them feels that they're of value and makes their life easier. And having that sort of approach has led to my continued career and evolving from being a very active clinician to partnering with Health IT to my current role as the CIO of Health IT, leading a very large IT team.
So tell us about how you got to Vanderbilt.
Well, once I finished training in Los Angeles, I had 2 kids, a mountain of student debt, and my wife and I decided that we needed to go explore somewhere else in the country. Otherwise, we'd be just stuck in Southern California forever. And I was fortunate enough to happen to be at a computer user conference at the Opryland Hotel back in 1996. And Vanderbilt happened to be looking for a critical care physician for the Children's Hospital, and thought I'd get an interview under my belt. I had no idea what Vanderbilt was about. This was before the internet, so you couldn't look things up that way. After several days in the enclosed dome of the Opryland, one of my future partners picked me up, and we drive around on I-40, and all of a sudden this downtown skyline appeared, and I said, oh my God, this is a real city. And then we happened upon the medical center, and I said, oh my God, this is a real medical center. And it was amazing just to see the potential of the partners that I would potentially be working with in the future. And after that visit, all the other interviews I went on, I constantly compared them to the folks at Vanderbilt. And I was fortunate enough a few months later to be called back and asked if I would be willing to join. And it was a great opportunity. Little did I know that Vanderbilt also was the epicenter of health IT at that time. Soon after I got here, we were just beginning to plan for the opening of the Children's Hospital, or the design of the Children's Hospital. And I was asked to be the co-chair of the IS design team. And a lot of work by a lot of people resulted in designing not just the facilities, but also what the technology would be in the future. We opened that facility with a fully wireless infrastructure, with computerized physician order entry, with digital imaging, everything in place. And it was an exciting time. And to see the entire technology community partnering with the architects and partnering with the clinicians and staff to create a system was phenomenal and just an incredible experience.
So you know what? My daughter was born in 1997, and we wound up at the Vanderbilt Medical Center in ICU in the children's wing. She had the croup. She was 5 months old.
Mm-hmm. Really?
So you were there when
I was probably there.
You were probably there.
You were there.
And she was under a tent, and we couldn't get her to sleep because she was 5 months old, and I crawled under the tent with her to get her to go to bed.
It's always incredible, I think, how in healthcare, on the surface, it can seem so out of touch at times. When you really look at healthcare closer, everyone has those stories. Mm-hmm. Like, it's something that can seem so overwhelming. It's maybe intimidating, but it's something that we all experience.
Everybody has a story about, themselves or their parents or their children.
And those stories are not necessarily always feel-good stories. They can be stories of frustration or of how things could be better. And I think it's important to listen to all the different aspects. It's easy to listen to the stories, and obviously we have incredible care providers at Vanderbilt, and many, many kids and adults are cared for in ways that markedly change the trajectory of their disease and they get better. But the other parts, we know that we sometimes don't do well. And you always want to ask the question, why? How could we have done that better? And that evolution, that willing to ask those questions, are what really drives us to take advantage of opportunities to make change, whether it's in the way we do things or in the tools that we use or utilizing the tools we have in a different way. And I think that's been the most transformative nature of how we have tried to approach the use of IT in the care delivery at Vanderbilt. And now it's taken for granted because everybody's doing it. But at the time that we were doing it, it was still at a level where most people didn't think that it had a place. And we still had to convince folks that if they use the tools, the care will be better, or their life will be better, or maybe they may have to do a few extra steps, but the whole team will function better or practice with greater confidence. And those are hard lessons as we move forward.
It's a very difficult thing. So someone may have to spend an extra 15 seconds entering something to save 2 hours for someone else in the back.
Absolutely. And making those connections is the most important piece as we move forward. And our ability to try to show that in ways allowed a lot of tolerance from our clinicians and staff to at least try things and then appropriately push back when it didn't make sense or it was too much, because that forced us to make the system better.
Yep.
And try to figure out ways to make it operate better. Nowadays, everybody realizes that because the digital age is all around us, and all of us have the experience of, I'm not going to use that app. It takes too many clicks, or it's glitchy, or it doesn't do those sorts of things. Unfortunately, in healthcare, the amount of dollars spent to make these systems flow the way Apple spends the amount of money on making an iPhone work is night and day. And so the margins aren't there to do all of that design well. So I think if we can translate better what the needs of the end users are in a clinical environment, hopefully with the limited resources, we can make the system better.
So that reminds me of a time that I was speaking with you and trying to figure out what are some of the things that need to be tackled to make health IT better and to support organizations like Vanderbilt. And you pulled up your laptop and you said, if you can fix this, this would be a great help. And you had to have 200 icons on your desktop. It had to have been 200 icons.
Well, it wasn't that many, but it was pretty overwhelming, wasn't it?
Yes, it was crazy. So tell me, has that gotten a little better?
It has gotten better. What people don't realize is from the outside looking in, everybody thinks that, oh, well, that's the electronic health record. There's just one thing that you click on, kind of like you open Microsoft Word and then everything is there. But in my area in health IT, we have 400 plus applications that we are supporting that each have their own icon or a way to navigate to it, because in a complex health system, not everything is done by one application. And the more we consolidate applications, the better the flow is, obviously. Just like now you have Microsoft Office Suite, and you open up Word, you can open up PowerPoint, you can move things back and forth, you can have Excel, and life is pleasant. But imagine if each of those, if you were handed a computer and you had Google Docs, but Microsoft PowerPoint, or some other company's spreadsheet application, and you had to log into each one to do your job, and the data actually didn't flow between the two. Well, now welcome to health IT for the end clinician. And that sort of lack of cohesion or flow of information without having to know, for this I click here, for that I click there, I have to close this window to open that window to do XYZ, that results in a lot of frustration, a lot of feeling like your life is being driven by whatever the technology person decided was good for them to code, rather than thinking about what's good for you as a user. That was before that we had transitioned to our Epic platform. So it is better because we were able to sunset 110 applications when we transitioned to the Epic platform. But it's still not solved because there's still a lot of other things that clinical staff have to do depending on your area of specialty, whether you're in the front office, whether you're in scheduling, whether you're in the back office.
Right.
The more we can weave those tools together where even though there are different applications, the end user doesn't feel like they're separate things, that their screens don't have to change or they don't have to log in again. Those sorts of things make them be comfortable to take their eyes off the screen at times and actually get back to what their real business is, caring for the patient.
At least we've learned from the past, and we are trying to develop things more in a platform type environment like Epic or Salesforce or some of these other solutions.
Absolutely. I think platforms are important, but it's also important with each of these platforms to manage expectations because no one platform does everything. And our appetite for more and more things to be at our fingertips when we place individuals in having to context shift from being a frontline clinician to doing other sorts of things, or have a nurse also do scheduling in clinic. And that sort of context shifting makes it difficult. And if the platform doesn't do everything, and as we all know, there's no platform that does everything. That's impossible. But to have the platform work more seamlessly together, the more we have that, the easier life becomes. And I think we're getting into a better stage in those areas, but we're still not where we need to be.
So tell us about the complexity of integration and data exchange and HIPAA and cybersecurity and regulations and all the challenges that you're facing.
It's incredible the amount of challenges in that regard because you feel like you want to spend time making the tool work better to deliver better patient care, but you also have to deal with constantly changing rules. Just the balance of trying to meet regulatory requirements or payment requirements or other sorts of rules at the same time when those rules don't necessarily allow you to address a frontline clinician's need to solve a workflow that could make life easier or provide better patient care. And balancing those becomes just continued struggle. Our hope is that working with platforms that are already thinking about these things and collaborating with them, which we have the good fortune of being able to do at Vanderbilt, as we have a very good collaboration relationship with our EHR partner, Epic, that we're able to influence the way they're designing their systems because we have a history of focusing on some of those areas. And there's other areas that we didn't focus on that their system has actually elevated our ability to have data flow from front end to back end. So it's been a good give and take, right, through this process. The area that I feel that we need to really focus on as we move forward is we don't have the resources that we had once in healthcare to be able to spend the time to translate. When I was starting out in this work, the production pressures as a physician were nowhere near what we have now. And to take time out of your busy clinical day today is very, very different than it used to be back then. And same thing for our nurses or our therapists and all the individuals whose brain power you actually need to harvest in a way to understand how to design the system. You need to be able to understand and walk in their shoes a little bit, but to get them to have the time to be able to focus on that while they still have to deliver care. Those are hard in this day and age because everybody's margins are getting tighter. Everybody's productivity pressures are rising. And we have to figure out how to take advantage of opportunities where we have the attention of the leadership, our operational colleagues, as well as our technology colleagues, to be able to take advantage of times of listening to each other.
So there's a lot of talk about physician burnout as it relates to just the speed and the amount of cases and the amount of patients you need to see each day. And how much of a factor do you believe that adding a lot of technology on top of that influences that burnout?
I think it influences it a lot. There's no doubt that physicians became physicians to interact with people. They didn't do this to interact with a computer screen. And it's not the technology in and of itself. It's the time with which they have to spend doing those tasks. What we need to do is, if you view that you're utilizing the technology because your life is being made more simple or you can get out on time, then you embrace it. Look at how we embrace a rideshare app on our iPhone. 6 years ago, wouldn't have ever thought about taking a taxi home from downtown.
Right.
But now it's a normal part because it's easier. It's efficient, or it's the activation energy required to accomplish such a thing is not very high.
Right.
On the converse, if we have to book an airline ticket on an airline that makes you jump through 15 hoops just to figure out if there's a flight at a specific price, you tend to go to a different website.
That's right.
And you get frustrated. And it's that frustration of what are we asking our clinicians to do, and or why are we asking them to do it? And oftentimes it's not just the technology in that case, it's the design of what data are we asking them to do and who's actually asking them to do it. That's always a question in the role that I played as a clinical leader in IT, is always asking, do we really need the physician or that person to do that data entry point? Or is it a nice to have because somebody else's life is better? And if it's better because it delivers better patient care, then we have to decide. But if it's better because then the downstream person has to do less work, but a front-end clinician's life is made more difficult and they're distracted from taking care of patients, then we have to have a conversation.
Yeah, it has to be a win-win on both sides.
Yes, or an appropriate compromise in which both parties are able to contribute to the conversation.
Right.
You were just talking about the rideshare example and just this idea of retail and consumerism and just how in all these other industries we experience much easier interactions with removing that pain point from our lives of taking a taxi from downtown, right? So I'm kind of curious, as we're starting to look into the future, how do you see other industries like that influencing healthcare?
Well, they're already influencing healthcare in many ways. We are currently focusing on online scheduling, right? Our leader, Jeff Balzer, constantly says, I'm not going to a restaurant unless they're on OpenTable. So why would I go to a doctor who I can't pick up my phone and schedule an appointment with? Accomplishing that is the hard part, because how do you make sure that a person gets to the right doctor and or is the right specialist for them? You don't want somebody just saying, oh, well, I'll go see a transplant doctor today. Well, that wouldn't be appropriate. So getting all those rules understood in the background and having the system work efficiently are where all the hard work is. And that's where a lot of folks are spending their energy. So we are constantly absorbing ways that in the past, the thought was everybody would come to Vanderbilt. Now we have to figure out how to bring Vanderbilt to everybody else and meet them where they are.
I know it's not as easy as just going and saying, I want to go to Dr. Neal Patel, because you have to know, is Dr. Neal Patel in my network? Is this thing or this service covered by my insurance? You know, a lot of different things. Are you accepting new patients or not?
Absolutely.
You know, what days do you work? What hours within the days do you work? And then you get to the what openings do you have?
Exactly.
So that's complicated.
It is complicated, and that's where the hard work comes in from behind the scenes. And it requires our folks, even within Vanderbilt, to communicate from the administrative side or our scheduling side with the clinical side to understand what is the algorithm. When should certain types of patients come to you? When should they not come to you? And then how do we translate those into the rules that can then make the screens work the way they need to work in an app or on a website? That translation layer is the hardest part that people don't understand. Our worst situation would be if somehow we added to the distress of the patient, right, because we weren't able to navigate them in a way that allowed them to not have any financial burden or undue stress because we didn't do all the things that we were necessary.
What have we not talked about that you want to highlight for Vanderbilt or for yourself?
I think for Vanderbilt, our continued push is to continue to impact how care is delivered, how we utilize all of our tools, not just technology tools, to advance the way healthcare is delivered not only in the city or this region, but nationally. And that's one of the hopes that we have. We've always been in a place where new discoveries affect the way patient care is delivered throughout the country. We'd like to continue to be a place where looking at how tools are used or how technology is used can influence the way other folks can leverage those learnings in a way to continue to deliver better patient care.
This has been wonderful, getting to hear your story and hear your passion and hear what you're doing and what your team is doing. I think it's also really cool. I know Tammy is always able to bring in such interesting people in here, and she knows so many folks, and she's always talking about this Nashville community and how important the community is. And I know Tammy always, I think a mindset that she has is she shows up and gives and tries to figure out how else can she give. And so I think it's really neat how we are sitting here. You know, you're the CIO of a major medical center and you could be doing a lot of things right now. And you're choosing to open this dialogue and be sharing these ideas and talking about what we need to do next. Because when you rewind it back to the beginning of your story, you went from a moment of all these clinicians wanting to walk out and go on strike because they didn't want to use this technology. And then boom, 95%, they're all adopting it. And so you've had all these instances in your career where you've gone up against really challenging situations, but you're able to pull it all together. And so I know you all it's a process, right? It takes time and quite the challenge with healthcare and how many moving parts there are. But it is exciting to hear what you're doing and where VUMC is going in this direction.
Well, it is an exciting time, and I think we're in a place where we need to continue to push the envelope, because the expectations of everybody around us, whether it's the government, whether it's the payers, especially the patients, are ever rising in terms of making every process much more efficient and or meet them in a way that meets their expectations, because mediocrity and or a lousy experience is no longer tolerated, no matter how good you are.
I agree. And also, I believe that it has to be real time.
Absolutely.
On all the time. And direct access, things like scheduling and knowing what physicians you can go to and doing everything you can on your mobile app, because I think most people are demanding that now. And that's a tough challenge.
Absolutely. I mean, that brings us, we just recently crossed the over 500,000 patients have access to their medical record on their patient portal at VUMC.
Wow.
And that's just amazing, the fact that your lab data, your appointments, all of the clinical information that you need, and we're actually going to be working to bring more and more clinical information so that the patient has everything that they need to be able to not just only navigate VUMC, but also if they happen to go anywhere else, they have their data right with them.
So just one more question for you. You guys are setting the stage and as one of the leading medical centers in the country, and you know firsthand from the clinician side and also from the hospital and health system side, all the challenges and pressures. Any words of wisdom for all the other health systems out there?
Well, I think at the end of the day, the key is to continue to focus on the patient and what your core mission of why we're in this business, and not to get distracted by everything else and constantly question whether we still need to do it the way we've done it.
That's great. Great
What a
words
great
of
way
wisdom.
to wrap it up. Thank you so much. This has been
Thank
wonderful.
you. Appreciate it. This was fun.
Yeah, thank you.
Thanks for listening to How I Transformed This, Success Stories of Transformation in Healthcare, presented by Versus 12. To learn more about how Versus 12 is best situated to transform the healthcare industry and to follow along with this show, be sure to visit versus12.com/podcast. We'll see you next time.